Good morning, good afternoon. We're going to go ahead and get started. So welcome to the call on getting advocacy right, tools and resources for WASH and healthcare facilities. I am Lindsay Denny with Global Water 2020, and with me I have Joe Naughton. Global Water 2020, for those of you who don't know, is a WASH advocacy and facilitation group based in Washington, D.C. And we are working with Global Health Council to advocate and raise the profile of WASH and healthcare facilities, both globally and then at the national and subnational levels. So for the call this morning or this afternoon, wherever you are, just a few quick notes. If you could keep yourselves all on mute for the duration of the presentation, that would be helpful. And then when we get to the portion of the discussion section, you can either put in your comments in the chat box, or you can raise your hand, clicking the hand raise button, and then we can call on you to make comments, provide feedback, or ask questions. We purposely set this up as a call so that we could have a more facilitated discussion versus a pure presentation as a webinar. So I will go ahead and get started here. Okay. The call objectives this morning, we're going to walk through the WASH and Healthcare Facilities Toolkit. If you have not seen the toolkit yet, I will put a link to it in the webinar chat box in just a second here. We're going to walk through the 7 steps of the toolkit, hear from local WASH and healthcare facilities advocates. On the call this morning, we're hoping to hear from the Health Rights Advocacy Forum based in Kenya. And then the second half of the call, we'll have time for questions, feedback, and then to hear from your experiences advocating for WASH and healthcare facilities. So to give a bit of background as to why we put this toolkit together, in June of this year, we hosted a commitments gathering with Global Health Council to bring together organizations and stakeholders who are committed to this issue. Together, we pulled together 85 commitments, of which 52 were made towards advocacy. These commitments varied widely in the target audiences. So we had individuals and groups who are committed to advocating to national and subnational governments, including the US government, advocating to memberships or associations, advocating to their own NGO country offices, so if it was a headquarters, advocating for WASH and healthcare facilities to civil society and through media outreach to reach the wider population, groups looking specifically to target healthcare facilities and the communities in which they serve, and then also looking to raise this issue at major conferences and events to speak to the global community, whether that's the WASH community, specific elements of the global health community like maternal and newborn health, as well as clinicians, so advocating, for example, to the surgical societies. So with that in mind, we pulled together a toolkit for these organizations to support this advocacy efforts. So this framework, this toolkit offers a simple framework for advocacy, depending on which stakeholders you're working with. It can be useful to raise awareness, advocate for policy change, allocate funding, drive demand, or increase prioritization specifically for WASH and healthcare facilities. So all the examples you'll see throughout the toolkit are specified for this issue. While many will be advocating to governments, you may find reason to advocate to other groups, including local communities, clinicians, or health facilities, or specific sectors. And finally, while this was originally written to support the quote-unquote committers who came together in June, we encourage anyone interested in WASH and healthcare facilities advocacy to look at this tool and see how it may be applicable to your own work. I'm going to now pass on to my colleague Joe, and he'll walk us through the toolkit.
Great, thank you, Lindsay. And hello, everyone, this is Joe. So next, what I will do is walk through the advocacy roadmap we put together and the 7 steps necessary for successful advocacy. So we did not develop the roadmap itself, but what we did within the toolkit was put together different prompts, resources, and tools to help you with your advocacy specific to WASH and healthcare facilities. So first, I'll walk through this roadmap, and then we'll talk about each of the 7 steps. So looking at step 1, the desired advocacy goals and objectives, looking at what do you want to achieve. Step 2 is identifying the target audience. So to whom are you advocating? Step 3 looks at putting together your message and the specific ask of your target audience, so the what. Step 4, identifying your messengers. So by whom is carrying your message to the target audience. Step 5 looks at identifying opportunities, resources, and risks. And it's important to note this is a step that you want to reflect on before engaging in any advocacy. So looking at where, what level, whether national, regional, or local, and when, looking at resources and capacities at your disposal, looking at your budget, what are your costs, what is your funding coming from, and lastly, identifying and managing risks and challenges. Step 6 looks at identifying activities and tools. So this is what you as the advocate will do and what tools you may be able to use to help you do this and achieve your objective. Typically falls into 3 categories: advocating, educating, and influencing. And lastly, step seven, monitoring, evaluation, and learning. So first, identifying concrete measures of progress to show that you are succeeding or maybe you need to adapt. And also reflecting on the efficacy of your campaign and making changes accordingly. And lastly, evaluation. Have you achieved your goals? So first, beginning with step 1, your desired goals and objectives. What do you want to achieve? So the goal is the overarching. It's the overall vision for WASH and healthcare facilities. So we all know the global vision is 100% WASH and healthcare coverage by 2030, with benchmarks being 80% coverage by 2025 and 60% coverage by 2022. However, your specific goal may vary based on context or country. And your objectives are more specific. They're the measurable action needed to achieve your goal. So we have a couple questions here to help you think through and determine your objectives. So why, first understanding why WASH and HCF is a problem. So we know WASH and HCF falls between 2 sectors, WASH and health, and is not recognized as an issue or not given the expertise it deserves. So this can be problematic. And next, looking at what is needed to fill that gap, and what are the specific needs, and then setting your objectives. So what will the decision maker do, and the activities needed to get there. So what will you do to achieve these objectives as the advocate? And another thing important to note here is timelines. So consider realistic timelines for 1 year, 5 years, etc., and making sure to set both short-term and long-term goals and benchmarks for your goals to maintain ambitious targets while still being realistic about progress over time. And so here's just an example framework about how you can determine your goals and objectives with these keywords. So looking at funding, the problem here being there's not enough funding for WASH and healthcare infrastructure, for example, soap, toilets, and sinks. The gap then being there's no framework in place, so there's no budget line item specifically for WASH to allow for more funding to go towards WASH and HCF infrastructure. The objective then may be the Ministry of Health, working with other government working groups, creates a budget line item specifically for WASH and healthcare facilities. And then the activity for you as the advocate will be to work with advisors to the Ministry of Health and other government working groups to voice the concern, convene meetings, develop resources, and ensure that a budget line item for WASH as created and finances are properly allocated. And starting in 2021. So again, noting the importance of time there because advocacy is a time-sensitive initiative. And here just noting the objective, what the decision maker will do, as opposed to what the activity may be for you as the advocate. So next, looking at step 2, identifying the target audience. So to whom? The target audience is the decision maker who has the power to make your change happen. So a couple questions to get you thinking here. Who must you reach in order to achieve your goal? And who has the power to make your change happen? This audience may be at the global, national, subnational, or community level, and maybe a specific person, entity, or grassroots audience, depending on your objective. Another important note here is to make sure to do your research, to understand the political processes and government structures to your specific context. And this can help you identify who may be most effective to target and who may be the champion for whatever you are advocating for. So some example target audience listed here, the government, so maybe some advisors within the Ministry of Health or the Ministry of Finance, subnational district officers, other communities of practice, faith-based organizations, the private sector, or the local community. And we have more listed within the toolkit itself. Step 3, looking at developing your message, the what are you asking? So messages are the core of your advocacy, include both the importance of WASH and HCF and your specific ask of the target audience. So there are typically five elements to a advocacy message. These include the problem statement, the evidence, the anecdotal statement, the overarching goal, and the desired action. And we provide an example here. The problem, there's a rise in maternal and newborn deaths because of poor WASH services and a lack of IPC training in healthcare facilities. So the evidence could be that you provide would be information on WASH and HCF problem using the most recent JMP data, and specifically its impact on mothers and babies. An anecdotal statement could be a personal story from a midwife. So someone who experiences this issue on the front lines and who can provide a personal experience to this. The step forward would be the goal. So we talked about this. The global goal here would be 100% WASH coverage in all HCF by 2030. And then the desired action. It's that objective. It's what you want the decision maker to do. And it's the request that the NGO integrate WASH into its maternal and newborn health programming. So within the toolkit, Global Water has put together a series of different key messaging documents that are very helpful and can help craft your message to your specific needs. So these include key messages for WASH and HCF, talking points, as well as data for advocacy, along with other tips that can be useful during this step. So step 4, moving on, looking at identifying your messengers. So by whom? Who is carrying your message to the target audience? Messengers do not necessarily have to be within the decision maker's immediate circle, nor a specific person, and can often include the media, members of government, donors, faith leaders, or other close allies and organizations. And another important note is that there may be overlap between your target audience and your messenger sometimes, specifically for driving demand among a grassroots audience. So for example, if you want, again, drive demand among midwives for improved WASH and HCF, this might involve targeting midwives to demand more WASH services, but also using midwives and their associations as messengers to develop educational resources and further engage around this issue. So some example messengers listed here would be those particularly compelling for WASH and HCF, such as clinicians, doctors, nurses, midwives, mothers, health and WASH organizations. But again, there are more listed within the toolkit that may be more specific to your campaign. Next, step 5 is looking at identifying opportunities, resources, and risks. And this, again, is important to do before you begin any advocacy initiatives, and looking at what opportunities are at your disposal, what risks should you be aware of, while also reviewing resources, capacity, and budget. So in this step 5 within the toolkit, we provided a series of different prompts to get you thinking about what may be at your disposal. But what we have listed here, a couple examples. So opportunities. Are there opportunities to elevate your issue, such as global awareness days? Is now a good time to advocate, or should you wait until the next fiscal year or until a new political leader is in power? Will that be more beneficial? Are there messages you can use to leverage your advocacy? Are there groups doing similar work? Looking at resources, capacity, and budget. What do you have at your disposal? So for example, social media is a free tool. How can you use that to your benefit? What is your current capacity? How many staff do you have? Can you develop what you have for your objective? And what is your budget? Where's your funding coming from? So these are all important questions to consider before you engage in your advocacy. And then lastly, looking at risks. So are there potential challenges to your issue, and why? And understanding why and how you can maybe include them or discuss with them would be important as well. And lastly, we just have on the right here a SWOT analysis. So a tool I'm sure many of you are aware of, but just another way to identify strengths, weaknesses, opportunities, and threats, and walk through similar. Step 6 is looking at your activities and tools. So what can you as the advocate do to achieve your objective? And again, these are typically advocating, influencing, or educating. So here within this table, we have a breadth of different examples of different activities and tools that you can do for your efforts. And we advise to choose the most appropriate, both based on your target audience as well as the objective of your campaign. So for example, if you are advocating to the government, putting together a policy study or referencing a research paper may be appropriate, or putting together a presentation for a working group meeting. Whereas if you're advocating to the general public, trying to reach more people, on a letter to the newspaper, ads, banners may be more appropriate. So again, just some tools here that can be helpful for your campaign. One last note also is to mention the power of storytelling and personal anecdotes. And these can be just as important tools for advocacy and should not be overlooked. So while these sometimes may be specific to government and data may be more beneficial, it can be just as powerful to provide a story and a more personal experience depending on your objective. Step 7, looking at monitoring, evaluation, and learning. So this is the final step, and to reflect on, is it working? To continue to be effective, advocacy must also be adapted. So be sure to reflect on your strategy and adjust accordingly. A new strategy may be required with a different message, new messengers, or an alternative approach. And this may be something you learn early on. You may find out that your target audience is not receptive to your message, and you may have to find someone new, or you could find it out down the line and may have to constantly adapt your message. So constantly reflecting and being aware of that. Also, make sure to track concrete measures of progress and to evaluate on your successes and failures. So some example measures of progress listed here. The government may issue a call to action, resolution, or policy on WASH and HCF. You may have the development of national WASH and HCF standards and monitoring indicators. The integration of WASH indicators into the health management information system, or a WASH line item in the Ministry of Health or healthcare facility budgets. So lastly, we have put together an example here to help kind of show how these steps are put together and get you thinking about maybe what you could do in your own capacity. And I'll just walk through this. So step 1, again, the desired goals and objectives, the goal being 100% WASH coverage in all healthcare facilities, but the objective being much more specific and measurable action. So here we talk about establishing WASH indicators within the National Health Management Information System. The target audience could be the Ministry of Health, but much more specific, the committee revising the HMIS survey. Step 3, putting your message together. So remembering the specific ask and the different elements there. So here, integrate WASH indicators into the HMIS to ensure routine monitoring of the status of WASH and HCF by next fiscal year. And again, pointing the importance of timing, because often advocacy is so time sensitive and it's important to note. Step 4, identifying your messengers. So possible messengers for this objective could be the Ministry of Health focal point, WASH and HCF working group, health NGOs, WASH NGOs, WHO, UNICEF, UNFPA, or a academic institution. Step 5, looking at possible opportunities, resources, and risks. So a couple opportunities we have listed here. So this is national level advocacy and is currently ongoing within the Ministry of Health. So there's in line with the HMIS indicator review. So this is an opportunity to engage with that. Another opportunity could be that there's technical expertise from the WASH and HCF working group members. So you can use this as an opportunity to engage with people who already understand this issue to elevate your message. Possible resources and capacity. So you need to reflect on personnel time. Do you have the staff and the people to be able to achieve this? And also logistically, can you transport yourself to meetings? Is this possible? And then a possible risk. So what we have here is that the WASH and HCF is not mentioned in the Minister of Health's new community WASH agenda. So he or she may acknowledge schools and other institutions, but healthcare settings are not mentioned, and this could be a possible uphill battle for you. Step 6, looking at and reflecting on activities and tools. So what can you do as the advocate? Well, you would meet with the Minister of Health and relevant ministry staff. You could develop a one-page briefing document on WASH and HCF based on the latest JMP, as well as participate in all HMIS indicator meetings. Lastly, step 7, tracking your indicators for progress. So a successful measure of progress could be the HMIS committee acknowledges they will include WASH indicators. However, reflecting, you may realize you have to reduce the number of indicators you're advocating for. So say from 3 to 2 in order to succeed with this. And then lastly, success, the indicators have been integrated into the HMIS. So again, just a quick example there to give you an idea of those 7 different steps. And then the last thing I'll note is just at the end of this document are a breadth of different resources that we've provided, including, for one, a link to the washandhcf.org website, which has a lot of resources there, as well as links to other toolkits, a lot that we use to help put this toolkit together that are much more specific, that you can look at budget advocacy, as well as crafting messages, but also much broader ones that give you a better idea, put together by UNICEF and WaterAid and others. There's also links to other articles and videos to help inform you or others, or maybe craft your message as well. And lastly, just some common terms for WASH and HCF advocacy that you can use in your initiatives.
Great, thank you, Joe. Before we open up to a broader discussion, I did want to give an opportunity for Global Health Council to speak up and give some thoughts. They helped us put together this toolkit. So Danielle Heiberg, if you're on the line, if you could unmute yourself.
Great, thanks Lindsay and Joe. I just want to thank everyone for joining us today, and really
So Danielle might have dropped off, so we will see if we can get her back on in a moment here. If we have the Health Rights Advocacy Forum from Kenya, if you'd like to speak for a minute or two about, or sorry, a few minutes here, 5 minutes, about your experiences doing advocacy for Washington healthcare facilities, we'll hear from you, and then we can circle back to Global Health Council.
Thank you very much, team. This is Edward from Health Rights Advocacy Forum.
Is the Health Rights Advocacy Forum online? You'd have to unmute yourself.
Hello, you can hear me now? Hello?
All right. Danielle, do you want to jump in here?
Hi,
yes,
Lindsay.
this is, okay.
You guys can hear. What can I hear? Okay. There we go. All right. Danielle, are you good to go?
Yes, I'm here. Can you hear me now, Lindsay? I think everyone else can hear me.
I was on mute. It's great. We're just talking to ourselves.
Okay. I don't have much to add. I just really want to thank everyone for joining us today, and to also thank Global Water 2020 for really putting a lot of work into this toolkit. I think advocacy sometimes can be a bit daunting, especially if it's something that you as an organization have not quite taken on yet. So I think this is a great way to get started if you are just starting your advocacy efforts, especially around Washington healthcare facilities. And I really do hope that this is, like I said, a useful resource for everyone. And then also for those of you who may continue to have questions around how to get your advocacy started around this issue, please do continue to look at Global Water 2020 as well as Global Health Council is a great resource. I think, you know, there's a number of resources that have been pulled together from other organizations on the Washington Healthcare Facilities site. So I don't think we're lacking any of the resources we need to develop our messaging, and it's really developing our plans to go out and to start being great advocates for this. I know advocacy can also take a number of years to really get maybe to see your objectives achieved, but you know it can be a long and slow process, but I think at the end result, it's always satisfying. So hopefully this is a great and useful resource for everyone. Thanks, Lindsay.
Great, thank you. Apologies for being on mute on our end. And I appreciate hearing from Global Health Council and all of your support in putting this together. I think it's so important as we talk about the fact that Washington Healthcare Facilities falls between two sectors, that we make sure that we're having the input from both the WASH and the health communities as we develop advocacy. Apologies for cutting you all off, but I'll head back to the Health Rights Advocacy Forum in Kenya, and we'd love to hear from you.
Thank you. This is Edward from Kenya, Health Rights Advocacy Forum. Thank you, team, once again, for putting up this good framework. Having a look at the framework, we find it very useful for the works that we are doing. For example, it is very simple. We have been struggling to come up with a simple framework that can inform our advocacy work. And what we are pleased is that reviewing or going through the framework that you have shared with us, this is useful and it can be applicable in most of the works that we are able to do in the health sector. Quite important for us, we would want to see as a question, as among the 7 steps that have been highlighted, would we be able to include the second step, something like the barriers to the change, so that we can be able to identify the change, the root causes of the problems that we are advocating for, so that when you are identifying the target audience, the messages, then they'll be geared towards addressing the barriers that we are looking for. So I just want to ask whether it would be possible to have another step just before the audit, like it becomes the step number 2, addressing the barriers to the problem. What is the root cause of the problem that we have? So the advocacy issue wants to be addressed. That's that's only what I feel would make the the documents flow better so that you can be able to have a comprehensive framework around the advocacy framework. The other key issue that I'm pleased about is that it has brought very easy for us when we are developing identifying the opportunities and the risks, because that is where we often we are not able to capture the opportunities. And with this kind of a framework, we find it to be a great opportunity for us to be able to identify what kind of opportunities that exist in our works. We will be able to look at the environment in which we are working and be able to identify the issues that we need to take advantage of. For example, in Kenya, we have been able to take advantage of key opportunities, for example, during the budget making process or the planning at the county and the national government level. Those are kind of opportunities that we have been able to utilize, and we have been able to mobilize the civil society and the facility stakeholders so they can be able to take advantage of those opportunities. The other opportunity that we have been able to focus on is around the community, the stakeholders forum, the budget hearings, and also at the planning level, whereby this becomes good opportunities for the community to engage. But at the risk level, you find the risks you are not able to foretell often what kind of risk we may be able to encounter, because some of them merely emerge. And what we have realized, one of this is is politically driven, whereby the politics just come in because of the situation or the environment in which you are working in. This could be politically driven because of the political interests, and also the issues of what you call the personal relations between the community and the people at the leadership. And we find this has come to play as a major risk, because when they realize there is no good relationship between the political leaders and the technocrats within the ministry, then it becomes a challenge. And this often hinders the works around advocacy in the areas that we are doing. I would invite my colleague, Christine, we are not on the same desk, but she'll be able to give more highlights on the works that we are doing so that we can conclude at once. Christine, please go on. Christine, can you hear me?
Are you on mute, Christine?
Which Christine?
Christine Ajun
I'm
from HERAF.
Christine. Surname?
I think it's a different Christine, but thank you. Edward,
I think it is.
Edward, we can't hear you. Edward,
Yes.
it looks like her microphone isn't attached. So we can see if she can reattach that, and we can circle back to her. I do wonder, for the work that you all have been doing, I think this is super interesting. And you mentioned some of the opportunities to insert within the budget meeting processes and stakeholder forums. Were there, in terms of the messages you were carrying, were you specifically focused on the situation in Kenya? Did you bring in more of the broader conversations of WASH and healthcare facilities? How did you approach your kind of the reason why they should be thinking about WASH and healthcare facilities?
I think for us, we had the opportunity because we took advantage of the environment that health sector has been developed. And this is the time the counties, government, at the devolved level, were taking charge of the health. And the other advantage we had that we had some works that were going on in the health sector. And these works were allowed identifying the challenges that are kind of the issues within the health sector. And what came out clearly was that the parents or the patients were not able to access the services, because, especially at the lower level facilities, that is the dispensary and the health center, because of the lack of good WASH facilities. For example, we had facilities that had maternity services. Unfortunately, the demand for these maternity services was very low because they lacked clean toilets, there was a lack of water, and the sanitation and the way they were disposing their waste. And this discouraged parents from accessing services in those facilities. We therefore took advantage of that kind of a result to engage with the county government and the leadership within the health sector, so that they could see the importance of addressing the wash in the health facilities, because it was emerging as one of the hindrances of why there was less uptake of the services in these facilities. And again, what came out clearly was lack of finance to facilitate, to be able to meet the demands for wash in the health facilities. This came after the country adopted the free maternity or free services in level 2 and 3. Therefore, the funds that the facilities used to collect from the services they were offering, these funds were no longer available, meaning the facilities were staffed. Therefore, wash in the health facilities now was not prioritized as one of the key areas that the government or at the county level would put resources for. And therefore, this again now it became counterproductive, because now the services were no longer being demanded for. The other opportunity we took advantage of in the two counties that we are working in, that was Isiolo and the Nyeri County, is that these were pilot counties that were testing universal health coverage. And to test the universal health coverage, it made again health facilities, services at health facilities free of charge. And therefore, what was needed was people to present themselves for services. Unfortunately, again, the same trade was repeated, that despite coming up with the free services at the level 2 and 3 through the universal health coverage, the services were not, the demand did not increase. They still continued to go for services in level 4 and level 5. Again, this was attributed to lack of clean or comprehensive wash facilities in these rural level facilities. And therefore, it became an issue that required to be addressed. And therefore, during the budget making process, again, now, that is the time now the county is starting to factor in the need to address the issues of wash in the health facilities. Though that has not been comprehensive in all the facilities that we are working in, but we can see there are some quite good developments that are taking place. We have also seen some change of mindset from the leaders, who have seen it is important for them to start addressing the wash in the facilities so they can be able to increase the uptake. The other change that we have seen, that the facilities that did not have water throughout their skin, we have started to improve, to provide other equipment that can substitute availability of the wash facilities in the health facilities. So therefore, we have seen that there are some development, including trying to get some supporting staff who can be able to take opportunities and be able to clean those facilities, because again, where the challenge was that even where the hygienic condition was poor, and therefore with the poor resourcing, then they were not able to sustain the support staff who are supposed to be able to clean those facilities. But now we have seen at least some development in terms of trying to support the support staff who are now being dedicated to be cleaning the facilities quite often. And this has also encouraged the uptake of the facilities. The other thing was allowed, why? Because the importance of the universal health coverage was to reach the most poor or the most vulnerable in the community. And this came out again very clearly, why, for example, people with disability are not able to access services, especially in rural level facilities. It's because, again, their wash facilities are not friendly to people living with disability. We have also, this has necessitated some of the facilities now to start to modify their wash facilities, especially the toilets and the bathrooms, so that they can be able to be accessible by the people with a disability. This came out and they were able to listen with the leadership, and we have seen some changes taking place. So those are, in a nutshell, some of the key issues that we have been able to do in our project in the last 1 year.
That's fantastic, Edward. And thank you so much for giving some specific examples. I think issues such as how you see the relationship between UHC and then the access to WASH infrastructure and services within a healthcare facility, and making those connections where I think UHC is not typically talked about in that way. So I think it's there's a lot of opportunities here to see how you take advantage of situations like stakeholder forums where you can raise this issue, and really tapping into the health sector processes to ensure that WASH is integrated. So I do want to open it up for questions. I do see a question in the chat box that I can go through, but if you have feedback on the toolkit. Thank you, Edward, for your thoughts on barriers. It's something that we've talked a lot about how you do research about your issue in advance, and what might, not only what is the problem to why there is no WASH, but what may prevent us from even moving ahead. So we'll definitely look at that. But even other feedback on the toolkit, questions about the toolkit, or reflections or lessons from your own advocacy in this space. Particularly love to hear from those doing WASH and Healthcare Facilities Advocacy, but if you've done similar advocacy that might be translatable, interested to hear from you as well. So you can either, oopsie, sorry about that. You can either open the chat and put it in the chat box, or you can raise your hand and we can call on you and you can unmute yourself. So I'll give you all a second to think here. And while I'm doing that, I'm going to take a look at this note from Steve, who has asked, his question is about how we can use peers as part of the advocacy effort. But can we find some government ministers who've seen positive health, social, economic benefits, and ask them to speak at multi-country ministerial meetings, do testimonials that could be sent via social media or email, write letters endorsing WASH and healthcare facilities wherever there is a need to improve conditions. So I think this is looking at multi-country or global advocacy, and how we can take government advocates and other advocates who could speak to that. I think this is a great idea. Before I answer this though, Edward, do you have any specific thoughts from your experiences, or Danielle, where you could see bringing in advocates across countries?
Come again, just repeat again. I didn't hear clearly.
Do you see any advantages or opportunities where you could take Kenyan advocates, for example, and think about regional advocacy within East Africa, for example? Do you think that's something that we could consider as an opportunity?
Yes, that's a good opportunity that we can be able to take advantage of, especially that within Kenya through the East African community, whereby the issues around health have been looked almost facing similar problems. What happens in Tanzania, what's happening in Uganda or Rwanda, or even our neighboring country, Ethiopia and Southern Sudan. We seem to be having almost similar problems. And again, the issues of our healthcare systems from community level to the national level, they all seem to be having a similar structure. Therefore, what works in Kenya is most likely to work in these other countries in East Africa. Because when you look at the write-ups on the most of the documented reports, you find what has worked in Tanzania is also working in Kenya or in Uganda. And therefore, I strongly feel this is something that can be replicated, and the lessons learned in Kenya can also inform what kind of programs we put in Tanzania or Uganda. I think the only challenge is around maybe around the political interest and the political leadership, or again, maybe the way the Kenyan government is so structured now that we have quite devolved, where the Uganda and Tanzania or even Rwanda have maintained the district system. But in a nutshell, we strongly feel we are working under the same rule or the same structure of the healthcare system. And our challenges in the health system are almost similar, and therefore what we are doing is able to be replicated. I therefore vote and recommend that we can be able to have a regional program that can be able to address this, and this will also help us to be able to learn what is working and what is not working, so that we can also have a good platform for exchanging ideas.
Yeah, I think that's a great point. And I see Christine on here. Christine, if you wanted to unmute yourself, I might be able to do it for you. Love to hear from your perspective as well in Kenya. I'm going to unmute you. Can you hear us? No? There we go. Christine? Well, you're unmuted. So if you at any point want to pop in, if your microphone's working, we'd love to hear from your experiences in Kenya to augment what Edward has provided for us. One of the things we've been talking about at Global Water 2020 is bringing together first ladies in Africa, particularly the First Lady of Kenya, but also speaking to other First Ladies in Namibia and in South Africa. So thinking about this, how they can be representing the issues of their country, but also talking about it in a wider forum across countries to raise awareness and to, like you say, almost doing the testimonials and talking about why this work is so important. So I absolutely think, Steve, there's opportunity for this. In addition, we think about where the ministers come together. So we know that the finance ministers are coming together at the Sanitation and Water for All World Bank meetings in April in DC. And then there are, of course, the World Health Assembly. The ministers of health will be coming together. And I believe, is it next year that there is the WASH ministers sectoral meeting with SWA. So number of opportunities in the next year or two where we can be working with the governments and the government officials to be raising this issue. I know that at the 1-year anniversary of the World Health Assembly resolution, there will be a side event or some kind of event celebrating the 1 year where we'll be hearing from the different countries and the work that they've been doing. So certainly if you're working in a specific country and want to make sure that that work is elevated, talk to your countries, talk to these ministries of health about raising this issue at the 1-year anniversary. It looks like Habib, you have your hand raised. I'd love to hear from you. And for those who were on the call earlier, and we walked through the example of how you bring budgeting or how you bring the HMIS indicators in, that was actually drawn upon Habib's experience in Uganda. So Habib, if you want to unmute yourself.
Hello, thank you, Lindsay. Yes, so in Uganda we had there's actually a lot of work going on in Washington healthcare facilities, and it's refreshing now to see at the top level of governance in Uganda through the parliament and members of the parliament on water and sanitation, and even the speaker of Uganda now leading the effort on advocacy in Washington healthcare facilities. All these began because we were fortunate to have pilot studies in 6 healthcare facilities in Uganda, supported by the General Electric Foundation. And the way we worked this was to do peer-to-peer mechanisms, so encouraging these hospitals to work together to improve Washington healthcare facilities and their systems. Based on this, they're able to go to the national level through a stakeholder engagement to speak to the top levels of people who in policy about how to improve Washington healthcare facilities in Uganda. So this has led to showing evidence in their healthcare facilities and other international organizations like UNICEF and WaterAid also subsequently doing assessments in various healthcare facilities in different regions to bring up the information to policymakers about this is the conditions, we have to do something about this now, this is unacceptable. So in Uganda, this led to embedding of Washington healthcare indicators into a national health monitoring information system network, which now is being rolled out. So I would like to say that it's a lot of factors, but what you've showed in the toolkit really shows that you have to deliberately go in terms of targeting audience. Who are your messengers? You have to do this deliberately in order to improve, to bring about advocacy and bring about this in the national limelight, which could drive change.
Thank you so much, Habib. And I think one of the things so Habib and I worked together at Emory University prior to my joining Global Water 2020. And one of the things I think that's come out of a lot of the work that we've done between working with the ministries of health in Uganda and Cambodia, where I was based, is that it doesn't take that many people. I mean, I think for both of our groups respectively, Habib, there were a small number of advocates from different organizations who were working with the Ministry of Health to raise this issue, speaking as well to the Ministry of Water. In Cambodia, we had a working group of a member from WHO, a member from UNICEF, myself, and a member from WaterAid. And between the four of us, attended a number of different meetings, raised a profile, identified a focal point for Washington Healthcare Facilities in the Ministry of Health, created guidelines. And so certainly there was personnel time and effort, but we were working together from different institutions and different angles, able to raise this issue. So if there's anything I'd want to kind of drive forward, and certainly true as you hear from Edward, is that you don't need a 40-person institution to be able to bring this forward. I think that all of us have the opportunity to advocate for this issue and raise it forth, whether you're looking at talking to midwives or you're talking to ministries of health or the communities. And hopefully this toolkit will help you be the most effective with that. Looking at other comments in the chat box, it looks like we have a note from Zimbabwe, and thank you, Masuki. He says that they've not yet started a concrete intervention in Washington healthcare facilities, but they have started to reach out to key stakeholders in the government from a technical working group. The group will include WHO, UNICEF, and government representatives from environmental health, infection prevention and control, health information unit, quality control, and family health. The Department of Environmental Health has been a champion to advance the issue, so that's really important, of course. And it'll be great to learn from other countries on how best they've advocated and advanced the issue with many stakeholders. So great, thank you so much for sharing these experiences. And I think that, again, demonstrating that a number of partners from small organizations can rise this ahead. We have other comments or feedback. I hear someone in the background with their mic open, so perhaps they're able to speak up. Is that Christine there?
This is Christine McMillan from the World Evangelical Alliance. Theme target audiences. Could we include a desire for coalition building and the regaining of trust amongst the various parties and stakeholders, particularly the community? It's our experience that when there is coalition building, there is then also a way forward with the new revised resource and way of thinking that creates an ownership for the people that are so involved in using the resource. So I think the idea of unity through a coalition building approach moves things along a little faster and then becomes inclusive of all the issues around the same table.
Thank you, Christine. That's a great point, and something that we've talked a lot about, particularly at the country level. When we looked across the commitments that were made on Washington healthcare facilities, you could see that a handful of countries had a number of organizations working on this issue. So I think that there is opportunity then to perhaps, for example, in Malawi, in Cambodia, in Uganda, in Ghana, to bring together more of a unified voice for this issue and to focus on given audiences, target audiences, and to unify the messaging of what it is that we're actually asking for these actors to do. On the global level, I think that WHO and UNICEF are really the leaders for the coalition, and I encourage you all to engage with that process if you have not already. If you would like to be more involved, please feel free to send me an email or to reach out to Arabella Hayter. I can put her email on here. But I think that they're really the ones leading the charge, and we can continue to disseminate the information that they share, to raise voices, and then also to be, as non-UN actors, I think we have the opportunity to be engaged in a different way, to be the voices outside, to be talking with the governments, pushing the governments in a way that sometimes the UN agencies are unable to. We have other comments from those out there, questions, feedback. We've talked about some of the risks and barriers. We've talked about coalition building, opportunities. So I will also wanted to make a note of the Year of the Nurse and Midwife. So for those of you who are unaware, next year, 2020, is the Year of the Nurse and Midwife as designated by WHO. We've talked a lot within our organization and with partner organizations about how critical midwives are to moving this issue forward, and particularly focusing on the delivery room and the experience of the mother and the newborn as being so impacted by WASH. So I think that we haven't done as well as we could have to engage the midwife community and mothers as well. And so next year, I think, is a great opportunity. It will be not just a celebration of midwives and nurses, but also it will be a platform for them to use their collective voices to talk about what is needed for safe maternal and delivery care. So we have put together an engagement strategy for the Year of the Nurse and Midwife that's meant to be crowdsourced. It's meant to be used by anyone. So if your organizations are interested in using that component of advocacy, whether on the global level or the national, subnational, or even the facility level, I will be sending that out in the next week or so. Ours is ready, but WHO has not put their calendar out for next year for the Year of the Nurse and Midwife. So I'm waiting to see that. And then I think there's a number of opportunities, and we don't all need to coalesce there, but whether you're working with the Midwife Association or the Nursing Association in your respective countries, working with individual midwives at the facilities, and having them raise their voices and demanding this need for WASH, or working with, for example, the International Confederation of Midwives, and having them speak on a global platform about the need for WASH in all healthcare facilities. So putting that out there as an opportunity. I'm going to open up to Susan Barnett, who's going to talk to us a little bit about messaging before we close down the call, if there's no other comments. And if you have any other thoughts, please feel free to put them in the chat box.
Hi, everyone. It's Susan Barnett here. I work with Global Water 2020 leading communications. And so I just want to put a plug in for messaging. One of the things that we know from just real basic marketing is that it take people up to 7 times to see something before it starts to set in. And so we really want to focus our messaging on being a consistent drumbeat, clear, concise, and consistent. And so to that end, we've put together some basic consistent messaging for everyone to use as they see fit. Feel free to adapt it. It's part of the toolkit. Joe, do you know what page that's on? By chance?
Yes, it is page 6. And there are a couple different links that link to a Dropbox that have a breadth of different documents that Susan is talking about.
Great. So again, feel free to adapt those, but I think it's really important if we can to keep wherever we are in the world to share consistent messaging. That's how we're going to be able to push through and be heard. So I think that that's a very, very important tool within your advocacy work. And so to that end, we've got a lot more material than what is in the toolkit itself when it comes to communications and messaging, as well as I can be a free resource to anyone if you want to try and do a little bit of media engagement, like I mentioned in the chat box a little earlier, working with MOHs to help them help us. So I've put my email down there. Feel free, oops, I made that private, didn't need to. Sending my email to everyone. And so if you want to get in touch with me, please feel free. Oops,
Great.
Sorry about that.
Thank you, Susan.
Sorry about that.
Yeah, thank you, Susan. And to the point about messaging, certainly we want to make sure that we are all kind of speaking with one voice, but recognizing that we are not the end-all be-all kind kind of decision makers on what that one voice should sound like. So if you have feedback on the messaging documents, on the advocacy toolkit, we'd love to hear from you. We do want to make sure that we are hearing from experiences on the ground, what's working, what's not working, what's been the most effective. So
yeah, I will say that's invaluable. If you can send us the what's working, what's not, that would be terrific.
Yeah, great. Habib, do you have any more comments? Your hand's raised. Okay.
No.
Okay, thanks. Great. So I'll take the time to close down here and let's see if you have any more thoughts. I see one more note from White Ribbon Alliance. Fantastic on the Year of the Nurse and Midwife. Great potential to collaborate on activities. WRA, so White Ribbon Alliance, conducted a campaign of What Women Want that surveyed 1.2 million women and girls about their top priorities for reproductive and maternal health. And WASH was number 2 priority, and midwives was number 4 globally. So they're in the process to determine their strategy for the Year of the Nurse and Midwife, and have thousands of women's voices that can be used as evidence for citizen demand for WASH and healthcare facilities and for the need for midwives. So absolutely, we've used the WRA work as examples in our own advocacy work. I certainly encourage you all to do so as well. Kim, perhaps you could share a link to the reports you all have out on this. There's also some really fantastic photos that you all have taken that have women standing with a sign that say like, what I want for reproductive health. And they have signs that say things like clean water, safe facilities, toilets, things that really touch on WASH. And the most interesting thing of this is it wasn't a WASH questionnaire. This is just what women want. So I think there's some fantastic opportunities to use this in our advocacy in the next year, particularly as it relates to the Year of the Nurse and Midwife. So thank you for that. Thank you. She's put the link right in there. So awesome. So I'm going to come to a close here. I want to give specific thanks to not only Global Health Council for their fantastic feedback and support throughout this process, but also to IRC WASH, who provided substantial feedback on the toolkit and spent hours with us talking through what's the most effective way to really frame the steps of advocacy. And of course, to Health Rights Advocacy Forum, Edward and Christine, thank you so much for sharing your work on the ground and really helping us take a more critical look of what in-country advocacy looks like on this issue. And so for further information on WASH and healthcare facilities, if you're new to this or if you haven't dove much into it, please visit washinhcf.org, which is the WHO and UNICEF site for this. It has resources in terms of things like the toolkit and other critical resources that groups have put together. It has a page on data. It also has stories. So we'd like to hear from you all as you do advocacy, what's working and not working, and share with the broader WASH and healthcare facilities community. I also share those links with groups like governments, with donors, others who are less familiar, to put a more kind of case study, more storytelling experience on this. If you have questions, comments, feedback, please feel free to reach out to myself or Joe. Our emails are on the screen in front of you. We're always happy to hear from you all and want to make sure that we're not out of touch with this work as it's taking place. Joe, back to you for any final comments.
Yes, maybe just one last note. I appreciate all your feedback, and I really do want to stress again to reach out with any comments. I've noted, Edward, your note on barriers and peer-to-peer mechanisms from Habib and things like that, and continually stressing this is a working document, and we want to hear from you to help move this. So thank you again.
Great, thank you all. The recording of this will be shared in case your colleagues were unable to join. And if you have colleagues in Asia or the West Coast of the US, we will be repeating this call this evening at daytime for them. And so please share as you can. Thanks again.